Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with an August 18th, 2021 update from the Dubuque County Public Health Incident Management Team. Dubuque County and most of the state continues at high transmission, and our COVID case rate in the last 7 days is 107 per 100,000 population. We're definitely going backwards because this is about the same number of cases we were having last April. As we continue in the high transmission category, we need to remind ourselves of the basic mitigation strategies we've all come to, hate, quite frankly. Masking in indoor public spaces, whether you're vaccinated or not, physical distancing and avoiding crowded spaces, particularly indoor spaces, and not to forget hand washing and vaccination, are what we need to continue doing. Our local schools are starting in just a few days, and with the ever more contagious Delta variant spreading, it's important to continue these strategies. In-person learning is so important for our children to succeed, and the best way to do that for most kids is by heading back to school. In a school setting where not everyone is protected by vaccination, either by choice or because they're too young, the indoors, classroom spacing, activities, and just general traffic flow throughout the school make that a high-risk environment that needs preventative measures. Which is why the CDC, me, and my colleagues with the incident management team and our own Board of Health recommend everyone wear a mask in school and in indoor public places, as I previously stated. So let's talk about mask wearing. There's two things. It has to be worn properly, and it has to provide protection against droplets, which are sneezing and coughing particles, and aerosols, those tiny particles in the air you can't necessarily see that happen just from talking and breathing. Wear a mask so it covers your nose and mouth and is snug fitting on the face. Not the nose drop like you see just about everywhere. Second, we know that cloth, medical or surgical, and N95 masks all provide different levels of protection. So if you're going to commit to wearing a mask and wearing it correctly, don't you think it makes sense to wear an N95, the one that provides the most protection against droplets and aerosols, especially with the ease and rate of spread occurring right now? Plus, N95s are readily available at hardware and other retail stores. Now, don't get me wrong, if all you have is a cloth or surgical mask, by all means wear it. It will provide you some protection. But if you can get an N95, that is all the better. A new development that CDC is recommending is a third dose of vaccine for moderately to severely immunocompromised people whose systems do not always build the same level of immunity compared to people who are not immunocompromised. And fully vaccinated immunocompromised individuals are about 40% of the hospital vaccine breakthrough cases. So what does CDC mean by severely immunocompromised? This includes people who have been receiving active cancer treatment for tumors or cancers of the blood, received an organ transplant or a stem cell transplant within the last 2 years, and are taking medicine to suppress their immune system, those with advanced or untreated HIV infection or active treatment with high-dose corticosteroids or other drugs that may suppress your immune system. All of the people with these conditions add up to about 3% of the adult population in the United States, which is a relatively small amount at the local community level. So talk to your doctor about the third booster dose of vaccine if you are in one of these categories. We're also hearing about the predicted White House recommendation of everyone receiving a third dose of the vaccine 8 months after their primary doses. This still will need FDA and Advisory Committee on Immunization Practices, or ACIP, approval, which will take some time. That recommendation and much of the research occurring are starting to tell us that COVID-19 is going to be around for a while, probably forever as a recurring communicable disease. What we do know for sure is that there's no seasonality to the surges and cases with this virus. Our peaks and valleys of cases have happened throughout the year here, locally, and also during different seasons worldwide. One thing's for sure, we still have some great summer days left that allow us to be outdoors safely with others. So before school gets rolling and the cooler weather arrives, take advantage of the outdoors by yourself, with friends, families, your coworkers. We're in this pandemic for some time to come, so don't miss this great time of year to socialize and be with others. And let's keep those kids safe at school.